So all of us will have hair loss. But how much hair loss is considered significant? Hi, I'm Dr. Peter, and with me, Dr. Loo and Dr. Chai, and we'll be talking about hair loss today. So how much hair loss is considered significant? We always say, if you have more than 100 strands of hair fall in a day, then it's considered significant. But it's so difficult to quantify, right? Because we'll be losing hair on this sofa, we may be losing hair in the toilet and everything. I have a few patients that they are very obsessive about hair loss, and they come with an Excel chart. They will put down the number of hair per day that they found in the whole house. So she will go and collect the whole house, all this hair. And my question to her would be, how sure are you it is your hair and not your husband's hair? And he say, easy doctor, my husband has short hair, I have long hair. So anything long is mine, anything short is my husband. It made me realize that how important is hair to an individual.
So what is the simple way to track whether your hair loss is worsening over time? I think the simple method will be to check for noticeable changes like whitening part, receding hairline, scalp visibility, whether you can see through your scalp easily through the hair.
So sometimes also patient would tell me, right, like sitting under the fan. Last time is cannot feel the fan on top of the scalp. And now I can feel the wind on my scalp. That is also significant, very significant, right? And also bathroom is another place where you can track it. If you clear your hair every day, right? If you are the only one using that bathroom, then you will know.
Yeah, I think it's a balance, right? You are losing like 50 to 100, but if let's say it didn't grow back the 50, 100, then you can see the significant loss. So we are losing normally less than 100, but if you didn't grow back the 50 to 100, then you'll see the difference.
So let's talk about the commonest cause of baldness, or in medical term we call alopecia. So the commonest will be the pattern hair loss, right? Whether it's a male pattern hair loss, when we see patients start having baldness in the M-shaped pattern, we call it the M shape, and then from the crown they start to lose. So eventually the crown will merge with the M shape, and patient will not have hair at the center. We will call it parietal, and they will only have hair at the side and as well as the back of the scalp, right? Whereas female is different. Female pattern hair loss begins at the midline, where it starts to spread, the baldness starts to spread laterally to the side. So most of the time we see ladies presenting later than male, because for ladies they can side part it, from right side they turn to the left side, so cover the midline. And then when right side also starting to go, they turn left side, until there's no place to turn, then they present to us, right? Yeah, but what are the causes of pattern hair loss?
Pattern hair loss is a hereditary condition, and it usually develops gradually later in your life.
Genetic factor. Some with strong family history, we see the grandfather, father all have pattern, then you're at high risk of getting pattern hair loss, either female or male.
But nowadays, we're also seeing more and more without any family history also, right? Patients coming to us, even among, I've seen even as young as 20 years old, coming to me with significant hair loss, significant pattern hair loss. So we know that genetic is one, but there also lifestyle plays a very important role in this pattern hair loss, I find. Especially I always say those days, 11 o'clock, you try to turn on the TV, there's nothing there already. It's a black screen there. But nowadays we have all the medias, all the iPads that we can scroll until early in the morning. So sleep will be affected. And also the diet, with the introduction of more Western diet, I also find that it definitely affects this hair loss problem. Exercise is another thing. Maybe less exercise among the younger patients nowadays that leads to also, again, pattern hair loss. Okay, let's talk about treatment for pattern hair loss. Right, let's go to male pattern hair loss first. How would you treat a male pattern hair loss?
There are various treatments for male pattern hair loss, such as topical solutions, the anti-hair loss shampoo solution or minoxidil form, and medications such as finasteride, oral minoxidil, dutasteride, and other injectables treatment like PRP, cocktails of vitamins and peptide to stimulate hair growth. And the last resort will be hair transplant.
Yeah. What about female pattern hair loss?
Female pattern hair loss, other than those like topical, but we don't use finasteride, we use oral minoxidil, and also you can use oral spironolactone as well. So usually it depends on the patient preference. Some actually like to spray, some doesn't like to spray, some like to take tablet.
Some likes injectables, some cannot take injections, right? And actually those oral medication nowadays, they are very good, and also with minimal side effects. Like for finasteride, I always tell patient, the study showed that there's no significant difference, because when you talk about finasteride, patients always first concern is, does it affect my sexual libido or not? Because it partially blocks the male hormone. The study showed that there's no difference with those taking finasteride and those taking placebo. But still, having said that, I still have patients who feel more lethargy after taking finasteride. So for those patients, I just ask them to stop finasteride. Whereas minoxidil is something that's been proven to be effective and with long-term safety profile also. The only thing is you may have hair in other places, other areas. So for females, that's something we need to tell them properly, inform them, right? Otherwise, they may need to go for laser hair removal later on if it happens to them. Whereas spironolactone, we always emphasize that please don't get pregnant whenever you're on spironolactone, because it is also an anti-androgen. It blocks the male hormones as well. So if you have a baby boy, then there'll be a problem. Right? Other than that, breast engorgement, actually, you hardly see breast engorgement, and so it's never a complaint for ladies, But in terms of monitoring blood, anyone more than 60 years old, then we will check the electrolytes. Otherwise, it's also something that can be used. Now, just now, Dr. Chai mentioned about injectables, right? PRPs, and also growth factors, peptides, stem cells, something that, where we can extract patient's own stem cells from the back, the hair follicles there, and once we extract it, we re-inject back onto the scalp. Right? So it's something also very safe because it's your own. Even PRP is your own blood that we re-inject back. And hair transplant, like the Chai said, is the last resort, right? Because you can't keep on doing hair transplant. Even if you want to do hair transplant, you have to make sure that the scalp is healthy, the hair is healthy. Otherwise, whatever you transplant is going to fall again. Are supplements useful in pattern hair loss? Those days, we always talk about biotin and zinc. But recently, there's a very good literature review that look at all these previous studies on supplements for hair loss, and they found actually the evidence on biotin and zinc is actually very low. So nowadays, I don't recommend patients taking biotin and zinc. Whereas there are some studies on, for example, seashells. Certain seashells contain supplements.
Marine protein.
They're actually good evidence that it may help with the hair loss. But what is important is we need to supplement whatever that is deficient in the patient. For example, like we mentioned, iron deficient, right? Which is very common among ladies, menstruating ladies. So if it's low, we need to supplement it, right? Vitamin D is something that we look at also. If it's low, so with supplements. And of course, if the patient got thyroid disease, high or low thyroid, we need to correct back the hormones. Now, let's talk about telogen effluvium. Yeah. What are the causes of telogen effluvium?
I think one of the very commonly presented to us is after delivery. I think it's stress. Any stress event 4 months prior to the hair loss is actually contribute to the generalized hair loss. So this is one of the very, very common one. And the other one that we need to rule out is all the medical condition. We always make sure that we do a blood test for vitamin D deficiency, anemia, and also this thyroid problem. Anything else?
Major life changes, psychological stress, severe trauma after hospital admission, severe infections, and major surgery. All these can contribute to telogen effluvium also.
Even weight loss?
Yes, and crash dieting.
Crash dieting, and excessive exercise. Anything too much is not good for your health also. And because hair is something which has a high metabolic rate, every day our hair will grow. So when there is a stress, when there's a shock to your body, anything that grows fast with a high metabolic rate will be affected. And so hair is one of those that will be affected whenever you have stress, whether psychological stress or physical stress that we mentioned just now, right? And so the treatment for telogen effluvium is actually doing nothing. If the stress has been gone, has been removed, then the hair will grow back by itself.
For the medical reason, we need to treat accordingly. We need to treat the anemia, the thyroid problem, and also the vitamin D deficiency. So,
yeah. For example, if iron deficiency, right?
Yeah.
If we have given adequate iron supplements to the patient, then the hair will grow back by itself also. Okay, next, we'll talk about alopecia areata. In 2022, this disease suddenly became famous, during the Academy Award where Will Smith slapped someone, because talking about his wife who has alopecia areata. So alopecia areata, we know, is an autoimmune disease whereby your own immune system attacks your own follicles, and that's why causing patchy hair loss. How we diagnose it is basically it is non-scarring and you have patches or baldness of hair. And you can see also tiny little hairs there, which we call exclamation marks there. And then if under certain scopes, we can also further identify this diagnosis, make accurate diagnosis of this. So it's a clinical diagnosis. You don't need any blood tests to diagnose it. So it's an autoimmune disease. When you have one autoimmune disease, the risk of you getting an autoimmune disease increases. Like for example, my dad has psoriasis, and my sister has thyroid disease, and my brother had alopecia areata. So we know they are interrelated. So when a patient been diagnosed with alopecia areata, I'll ask them about all this history of autoimmune disease. And sometimes I may also run some blood tests to rule out these autoimmune diseases. What are the treatments that can be used to treat alopecia areata?
normally I use cream plus injection. Steroid cream is very helpful. And also we can inject intra-lesional steroid as well. But I always tell patients the process is not immediate. You have to wait for a while for the hair to grow back, sometimes months. How about you?
It depends on the severity. If it's more severe, I also will recommend injections like PRP to stimulate hair follicles activity.
Yeah. And for really rapidly progressing alopecia areata, because there are patients that, will tell you, last week I had one patch. This week I have another 2 patches. And after another week, they start losing eyelashes. They start losing the pubic hair. Basically, any parts of your body that has hair can have alopecia areata, can lead to alopecia areata. So when we are faced with this group of patients who have rapidly progressing alopecia areata, one of the options is also oral JAK inhibitor. Right? It's a very useful medication to treat alopecia areata, but it's just that I tell my patients, you need to be patient. Anything to do with hair, it's not immediate, because when you treat, it takes at least 1 to 2 months to see the results, even for your injectables also, right? We always have to tell patients, be patient. But there are very effective treatment nowadays for alopecia areata. So what about traction alopecia?
It's actually very common in ladies, young lady as well. They usually tie the ponytail, it's a bit tight. And then also sometimes a lot of hair pattern that cause the separation of the line. Very obvious. There's actually another condition that the pulling of the hair.
What we call trichotillomania.
Yeah, that was also very common in young lady.
Yeah. That one, how do we diagnose it? Because when we see the hair, right, there's actually different lengths. Normally hair loss is just one length of one patch there. But this one you see some still very long hair, some very short hair. Then from diagnosis, that one is actually, we need to work together with the psychologists, with the psychiatrists as well. Of course, if mild ones, then we just inform the parents, about the condition and inform the patient. And once they know it, maybe they'll be more conscious and they'll divert their stress, or try to reduce the stress, and the condition will also improve. Right? And the traction alopecia, just advice, right? We just advise patients, those ballet dancer also don't tie too tight your hair. Otherwise, it can lead to permanent hair loss from something that is, temporarily. If you continue to do that, as you grow up, it will become permanent. So if you have hair loss, don't panic. But at the same time, don't wait too long. Because if there's no more roots, I call this like a forest. If there's no more roots, we can't grow any more trees. Right? So make sure you seek help early from your doctors. Find out what is the cause and what is the treatment to address the problem.